How are the questions on that module for you guys?
It wasn't that bad.
Okay.
It was kind of tricky with the foot one. I think it was like the last question.
Okay. Good. Oh, thank God it's only 10. Wait, I shouldn't be the one saying that. All right. Well, let's start and then we'll get to that and then we'll do the injury prevention thing. I have a few things to say about that. All right, muscles. Many muscles originate from around the pelvis. One of them reaches from the sacrum to the greater trochanter. When it contracts, the femur gets pulled backwards, which rotates the foot outward. Can you visualize that?
Yep.
Yeah.
So, what is that muscle?
The piriformis.
The who?
Piriformis.
The piriformis. Yes, very good. So when I look at the PowerPoint part here, let me make sure it's a little bit like that. I got the piriformis here, which is kind of this medial group. There's a few more down here. You can see them here. I spelled them out in case you want to study more on it. But you know, they're all kind of do the same thing. They pull on this greater trochanter and turns outward, which turns the foot outward. If you visualize that. So if so all the muscles here in the back of the thing. Can you see me here? All right.
Yeah.
You see that in the back here? They go to the greater trochanter, and if they pull, they turn the foot out. And so that's what their main function is. Also, though, what's interesting about the piriformis, it's attached on the inside of the sacrum. It goes on the front side. And that stabilizes the whole spine going up. So when you visualize like you holding a broom upside down and you balance it so it doesn't fall over. It's kind of what that muscle does a little bit. So it's really overworked a lot of the time to stabilize the spine. And then it gets overloaded with, you know, pressure points and trigger points, especially when where these axes are. And then that then can squeeze the sciatic nerve. That's why I put that picture in. That yellow thing that goes down is the sciatic nerve, and then that gives you sciatica. But that can be an issue that you have that is not related to the spine potentially, even though that's what we often think about it, but it could be related to the tight muscle. So what you could do then is take a tennis ball. If you have symptoms shooting down the leg pain things, take a tennis ball and start just relaxing these muscles here. Sit on it. And then that will help with that. Or at least you can try it, and it should help a little bit. All right, good. There you go. See, that's my topic. I like this stuff. Another set of muscle anchor around the crest of the ilium and the external iliac fossa and reach to the greater trochanter and even further down the thigh to the outside of the knee via the IT band. That's the iliotibial band. Those muscles pull the leg outward as an abduction. Can you list the muscles that accomplish that?
The gluteus medius,
Okay.
the gluteus maximus, and tensor facial lateral.
Okay. There you go. So basically, the muscles start attaching here, and then they go to the greater trochanter, and as they get further up to the crest and then to the front, all the way to the front is the tensor fasciae lata. They then reach down and still attach to the greater trochanter, but a lot of them go further down and attach in this band. That's the iliotibial tract that then anchors into the knee joint on the outside. Do you understand what I'm talking about?
Yeah.
Good. And so, because you can feel that on yourself. If you feel, good, I have to make sure, I don't see myself, so I don't know if I'm on the picture or not. But if you rub around here on the outside and that hurts a little bit, that's the IT band. So you can see that, you can feel that there. And you can visualize when the muscles that are here pull on that thing, it's going to bring that leg to the outside as an abduction. And so all those exercises that you bring the knee up and all that stuff is going to help this stuff over here. So that's how you get a Brazilian butt. 2 squats. So there you see the gluteus maximus And then underneath, we got the gluteus medius here. The gluteus minimus is on the inside. And medius and minimus, they both go into the greater trochanter. The maximus goes further, a little bit down in here, but then further down into the IT band. Oh, let's see. I got some question over here. What's that about? Hey, doc, sorry for it. Okay. All right. Next. In the front is a set of muscles that help us lift the thigh up. One of them originates from the anterior part of the lumbar spine, which is very deep, all behind all the gut and all that stuff. And then it's got a cousin that anchors into the front of the ilium, which you can palpate that if you can touch it with your fingers if you slide them up in and downward along the crest of the ilium, starting at the ASIS. What muscle am I describing?
Iliotibial.
Iliotibial, good. So that is often that hurts. When you always sit like that and that muscle's from the deep inside and goes to the inner thigh, right in here, that is always contracted. So that's when you drive a long time and you get out of the car and it's like, oh, I got to stand up. I don't know if you have that. I have that. Then, you know, that muscle wants to be stretched out. And you can feel the iliacus come to the inside of the iliac crest, and then the psoas deep inside. That's where it goes into the spine. And so that's a very powerful hip flexor, but it's very often a trouble spot. And I say often that psoas give you a sore ass. Because look at the pain patterns. See, these are pain patterns. All these little red things with the X's, these pictures. These are the trigger points, but you got to go deep. You got to know how to get to that thing. Otherwise, you're going to squeeze some gut. See, look at how deep that thing is. That's the front of the spine. All the gut is on top of that. And then there's a trigger point right in here. And the pain pattern, a lot of it goes to the back. Look at that low back.
Huh?
So a lot of pain in the back is actually from that muscle. It's mitigated. And when we're back in class, I can show you how to work.
I don't know if it should be.
Huh?
No, sorry.
That's all right. All right, let's go back to the quiz question. Let's now consider the muscle around the thigh. Or do you have another question around that SOS? No? Okay. Then let's now consider the muscles around the thigh. If we group them broadly, we can make out 3 sets. One in front, one on the side, and one in the back. The muscles in the back group mainly occupy themselves in with bending the knee. What are they collectively called?
Hamstrings?
Yes. The hamstrings. Who's rebounding? I don't know what there's one is. I don't know if I'm the only one hearing that.
Somebody mute their beeping.
Some feedback, yeah. Just don't worry if it's when we talk, it doesn't matter. Just have to make sure it's a little as possible. So the hammies are the muscles in the back. Very often they're very tight. So that's why you want to stretch them. Kind of like that or something like that. And they are, if you think about it, they are attached to the sit bone. And then they go around to the upper knee, the lower knee, but the upper leg part, and then they contract. They're going to bend that knee. So that's what they do. Again, we sit a lot, so they're always contracted. So I guess that's probably part of why they're tight a lot of the time. The other problem is when you walk or when you run and you push off and you bend the knee to push off, you use them, and then you extend the thigh, and then the glutes work, and then you bend the back a little bit, and then the low back muscles work. So anything along that chain is too tight, it's going to give you trouble in another part. And so that's why it's interesting to understand the hamstrings. And we're going to have one of the injury prevention things I'm doing is looking at the hamstrings tightness. So I'll talk about that in a little bit. All right. Just in case you didn't want to be bored. The group in the front of your thigh are the most powerful muscles in the body. They straighten out the knee. These muscles are holding our bodies upright against gravity by keeping the knee from buckling. Can you list the names of the muscles that make up this powerful group?
the vastus medius, the
Mhm.
vastus intermedius, and
The rectus
the one the
femoris?
rest. Yeah, is it the
Medialis.
rectus femoris?
Perfect. The rectus femoris. Oh yeah, you know what I want to do is actually, hold on. I forgot about this. I guess I'm going to start that the next time. But I'm going to try to figure out how to make sure everybody pays attention to this whole thing a little. So I'm going to have everybody answer a question throughout the whole thing. So how about that? But tonight, we're not going to worry about that. So make sure next time you're knowing what we're talking about. So that's good. So what is that group collectively called?
Your quads.
The quads, exactly. So if you work out, that's one of those groups that they're right here. They're all in the front. What's interesting about those muscles is a lot of them start, not two of them start in the back at the linea aspera and then move around to the front. They wrap around and come down to the knee and then anchor into the knee. Into the tibia. So they go through the kneecap. So two of them, one comes from the back and then wraps around the outside and one wraps around the inside. Those are these two swellings. And then we have one deep on top. You can sort of see it. It's a lot of mass in here. When you take the top layer off, you can see that's the intermedius, and then on top is the rectus femoris. And the rectus femoris goes all the way up to the ASIs. That means it goes all the way up to the pelvis. So one of the interesting things about the biomechanics of the body is when you look at muscle function, you ask how many joints does it span, because it's going to do some motion at the joints that it crosses. And so the rectus femoris straightens out the knee mostly, but also when you think of it pulling on here and then goes to the knees, also brings the whole thigh up. And that's flexion, that's thigh flexion. And that is helping the iliopsoas muscles, which is the ones that we just talked about, the ones that go from let me go back to that real quick. The iliopsoas then take up from here and pull that leg up further and bring it up into, pull from the spine and from the iliac fossa. Does that make sense?
Yeah.
Good. I know that might be a little bit extra, but that way, hopefully, it makes it easier to understand those little words. Yeah, so if you have problem with the words, just label exercises and work with the material and do not do more than the term list. Don't try to understand more stuff than the term list. It's plenty of stuff. Okay? Please, please, please. Unless you're completely bored, then I give you an exception. Okay, onward to the massive muscle group that concerns itself with pulling the thigh medial as an adduction. It makes up the thigh medial muscle group with strong lateral stabilizers that make sure that we can stand, walk, and run without falling over. Visualize yourself running zigzag to understand that massive job that we have. So if we don't have those muscles, we're going to fall to the outside because nothing's going to pull that knee medially. What are we talking about?
The gracilis and the quadriculum.
Gracilis is correct. QL, no. One more.
Adductor longus.
Adductor longus. All right, gracilis and adductor longus.
Is Sartorius one of them as well?
Yeah, but the Sartorius is a different one. Let me show you.
Okay.
The gracilis. Well, here are all the adductors. So there is the Adductor brevis, the adductor longus, the adductor magnus. They're all on this side visualized. So one of them goes right here, the blue one, then the red one, and then the massive yellow one underneath it. The blue one goes to the front, they go to the pubic bone, and then the other two, no, I think the red one goes to the pubic bone too. And then the massive one goes to the sit bone. So they go like a little bit they go from the linea aspera in the back to the sit bone and to the front. And they yank that leg medially. Can you visualize that? When they contract?
Yeah.
They yank it medially. And then we got two more. We got that little sliver on top here, the pectineus, and then one that goes all the way down to the inner knee. And so all together, they yank that thigh in. It's just on this side, you don't see those last two. So that's those muscles. And then though we have the Sartorius. And the Sartorius sits on top of the front and starts here. It goes all the way down to the inner thigh, inner knee. See right here. It starts up here and goes all the way down to the inner knee. So that muscle, when it pulls on it, it more does the motion of the knee like it brings your foot over to the opposite knee to cross your leg over. So it does all this like flexion, lateral rotation, abduction of the femur. You know, it does all that stuff. But it's actually the way it's anchored is more brings it more the femur more to the outside than bringing it to the inside. And then it also does all this work on the tibia, technically speaking. But all this action is basically bringing your knee to the opposite thigh, crossing your leg over. But that's why the Sartorius is a different animal. It's its own little thing. It's just that superficial little muscle that just does this one. Well, it does a lot of things, but it's not really a main mover. It's just a helper in a lot of motions. All right, good. Let's do next. Any questions with that, or are you good?
We're good.
Oh, good. I'm good too. Let's move on to the calf muscles. Most significantly in the back, there are two visible swellings that bulge out when someone stands on their toes. These two superficial swellings, muscles have a third companion line underneath it. That is part of that group. Together, they assure our body weight doesn't collapse when the ankle joint's under gravity and when we stand upright. Can you name those two muscles?
The soleus and the
Gastrocnemius.
yeah, gastrocnemius.
There you go. Perfect. Soleus and gastrocnemius. There they are. So, together, they're calling them the triceps surae. Tri like in the triceps brachii, but in the down here, it's just surae is that area, and tri means three heads. So, because they're helping the same motion, really, the gastrocnemius and the soleus. They're both anchoring into the Achilles tendon in the back of your ankle and go up to the tibia and or all the way up to the knee, to the inside of the knee there, the joint. And so the gastrocnemius spans, again, the gastrocnemius is kind of like the rectus femoris. It goes two joints, so it actually bends the knee a little bit. But its main motion is making sure it pulls the heel bone up. And what that does is it makes us be able to stand on our toe. Here, see, and so that's why that is a big muscle group. The soleus is actually bigger underneath it, but it makes these two gastrocnemius swell out nicely and bulge up. You can see those in bicyclists a lot. All good?
Yep.
Yes.
Good. Next. All right. Hold on. There we go. Besides the superficial triceps surae, the deeper calf muscles can be grouped into three compartments. Anterior, containing muscles that extend the toes, which is dorsiflexion of the foot, or they also dorsiflex the foot and extend the toes. And then a posterior one that mostly plantar flexes the toes and the foot, so that pushes the toes down. And then a lateral compartment filled with muscles that significantly help evert the foot, which brings the little toes up and out. Which muscles dorsiflexes the big toe?
The extensor, the longest. I don't
Good.
know.
Hallucis longus. So hallux,
Okay.
if you see that word hallux, you don't think of Alex, you think of big toe. So see, you got the tibia here. This is the right foot, right leg. You got the tibia here, then the red green one goes right down and anchors right into the foot here, to the ankle. So that's the tibialis anterior. And then you got the red sliver, and the red sliver goes to all the toes, and that's the extensor digitorum longus. If you see a longus, there's going to be a brevis, but we don't worry about the brevis. I never remember the brevis. This stuff is tough. I have to always look it up when I work on people with it, still, after all these years. But that's probably just me. But anyway, then you got a purple puppy, and the purple puppy goes underneath and comes out here and goes all the way to the big toe. And if you extend your big toe, you're extending your hallux, and the muscle that does that is the extensor hallucis longus. Make sense?
Yeah.
And then on the bottom, I'm probably jumping on my next question. Let me make sure I don't do that. Maybe. Now let me just talk about that. If I don't care if I'm giving away the question, the answer, because so that's on the front, on the shin. That's the shin area, right at the outside of the shin. Deep underneath in the back, in the posterior compartment, we have the same thing. We got one muscle. Of course, they call it differently, but we got one muscle that goes from the back deep down to the ankle, posterior tibialis, that's what it's called, or tibialis posterior. And then we got two muscles, one going to the toe, the hallucis, and one going to the digitorum, the toes. And the hallucis pushes the toe down, and the digitorum ones flex or push down the little toesies, all the other ones. So it's kind of the same thing if you put your toes, bring your toes up or bring your toes down. You have the mirror image of those muscles. That way, these big names hopefully are not so big anymore, right? Hello.
Yeah.
Good. No, especially if you don't have to memorize them. Anyway, so that's why understanding, especially if you're online, I think it's much more important that you work on understanding the material than memorizing the material. That makes sense?
Yeah.
Good. All right. Twisting an ankle strongly makes the sides of one's calf achy and sore. That pain comes from the place where the muscles of the lateral compartment anchor into the fibula. Usually the most affected of them is the one that reaches behind the lateral malleolus and from there travels underneath the foot to anchor on the inside of the longitudinal arch, which is kind of crazy. That's like a cable going underneath your foot. So if you twist your ankle to the outside, there's a likelihood that digging your muscles, your fingers deep into that medial foot underneath the arch is tender. Did anybody try that? No.
No.
I was just
You
told
gotta
to walk
do it,
off.
man. It hurts if you do it, and you have put it, stand on a billiard ball or something like that. But what muscle am I talking about?
The Fibularis Longus.
Yes.
What she said.
Fibularis Longus. Where is it? Give it to me. It's one of my favorite muscles, by the way. If somebody come in with his twisted ankle, I can always work that, and you just massage it nicely up and down, and trigger pointy, and a little bit of that, and they're screaming, and it works like a charm. But if you think about it, if you twist your ankle, that thing goes all the way underneath here, and if you break these ligaments on the outside of the foot, that muscle is going to stabilize that motion, so you don't just flop it over. And I got a patient, he described, we talked about it because he's got a floppy ankle. And he describes it like he runs, and he used to be really good at jumping. He feels like something's just hanging there, and he can't stabilize it. So that's when that muscle really has to work hard. Anyway, that's that question. I know, I'm getting there. We're getting there. Good. The last muscle group lies deep posteriorly underneath the triceps. Okay, that's the one that I just talked about before. The three muscles attached to the tib fib in the back, and from there travel behind the medial malleolus to then anchor into the medial arch and underneath of all the toes, including the hallux. Which of them inserts into the tarsal metatarsals?
Tibialis posterior.
There you go. Perfect. So that's the foot muscle. So what was the question with the foot muscles? Or let me show it, and then we. There was this clarity about that, right?
I think it was actually it was number 8 that I was confused about.
Did it clarify?
Yeah, I did.
Okay. So then that's good. So we're good with that. The other one that I did not talk about, but is in the booklet, is called popliteus, and it's a very interesting one. It's in the back of the knee, right on top. Goes from the top outside of the knee and the top one to the inside, right there. When you sit down, it's on the inside there, right above the tibialis anterior kind of place. If that's really sore, that's also a good place to massage. Well, you know, I work on people, so I got to put these kind of pictures in. So with that, how is that understanding of that material?
It's a lot.
It is, right? Well, you don't have to memorize it. You have
That's
to be
true.
able to access
Understand
it.
it.
How is it the understanding of it? Like, if you take the big words away, do you feel like you kind of understand a little better how the body moves?
Yeah.
Yeah. I think it's just when you get down to the foot, like there's so many parts in there that it gets kind of a lot.
Oh, it's crazy. I know, it's totally crazy. In the hand, at least, I mean, you got many muscles in the arm, but at least it's just two sides. You don't have that
Right.
outside thing. And that's why in the foot, that's why at some point over time, I started grouping them into motion patterns or in a lower leg, like where they are located. And so the foot is like the arm. It's got that outside component to it. So
Okay.
then I understand it a little bit better in some ways.
So is the tibialis anterior, is that where you would get like shin splints?
Yes.
Okay.
Like if you have a collapsed arch, for example, if that's not so strong.
Would a collapsed arch be like flat-footed?
Yeah.
Okay.
Then the tib anterior gotta go. Look, if the arch down here is not so strong, going up enough, if it's flatty, or even if it's not stable somehow, but that muscle often swells up and gets overpowered.
Right.
And even if you think about it, you visualize the arch going down a little bit, it pulls on it. So even that alone is going to irritate it more. And then one of the things that's a trouble in the leg is you got these three compartments, but if you go deep on the bone level, those three compartments are kind of compartmentalized with thick fascia, with thick like septa, they call them. They're like, thick bands of rubber, broad, thick rubber bands. And the muscle force, a third amount of muscle force is not actually the contraction portion, but it's how much does it push against that envelope of that where it sits in. And then by pushing against it, it gets stronger. Does that make sense?
Yeah.
And so if down here, if people like basketball play and they keep playing on the inflamed tissue, it can be that the muscle gets so inflamed, it pushes too hard against those membranes and it does not relax anymore.
Okay, yeah.
And then they have to cut them open.
And
then they lose, 20% of their power, and that's it. Their career is over. So that's one that made me think of that compartmentalizing into three sections, because that's another element that comes up when you look at sports medicine or stuff like that.
Okay.
It's compartment syndrome. That'd be a compartment syndrome.
Okay. Thank you.
Anybody else? Come on, I like the stuff. After this, it's boring. No, it's not. Then we get to the brain. The brain's intense, so the brain you got to pay good attention to.
Wait, I thought after this was the heart.
Yeah, then we do the heart, and then we do a bunch of stuff, and then we get to the brain.
Oh, interesting.
I know. The heart, the blood, the endocrine. Oh, it's going to be fun. But don't worry, I got a really good way of doing it. I'm already thinking about doing that test, so don't worry about it.
I have a quick question.
Yes.
I kind of missed when you were talking about, because we're on the anterior leg compartment here, and then it has like the extensors, and then on the back they're kind of like the same, just flexors.
Look at this one, and then take the top layer of your back muscles away, and underneath, look at that. There's also three of them, and one of them goes to not to the outside here, but to the inside of the ankle. That's the tibialis posterior. Now it's not the anterior. In front, it's the anterior. In the back is the posterior. And then we have one that goes to the hallux, the big toe, and one that goes to the toesies, the digits, the other ones. And that's the same as in the front. It's just now it's not an extensor. Now it's a flexor.
Oh, okay.
So it's just the opposite motion. Cool. So that way, you think mostly what the toe and ankle does is this. A little bit of this, but not that much. Mostly this. And so that's what those two front muscles and then the back muscles are designed to do. What's interesting is with the back, to get it a little more confused, that the big toe muscle starts on the outside where the small toes are and then crosses over to go to the big toe. So there's a little bit of a crossing in there. That's kind of interesting too. All right, any more questions to that?
Nope.
3, 2, 1, go.
Nope.
All right.